On behalf of the Patient Safety Authority, I'd like to welcome you to this web conference entitled Hepatitis, Do You Know Your ABCs? My name is Linda Nato, and I'll be your moderator for this program. Now I'd like to introduce our speaker for the webinar, JoAnn Adkins. JoAnn Adkins is a registered nurse and a senior infection preventionist for the Pennsylvania Patient Safety Authority. In her role at the Patient Safety Authority, she works with healthcare facilities to improve patient safety through infection prevention initiatives. JoAnn is a graduate of the Reading Hospital School of Nursing and Eastern University. She is board certified in infection control and epidemiology, and she is a fellow of the Association for Professionals in Infection Control and Epidemiology. JoAnn has a very impressive resume, by the way. So JoAnn, now I'd like to turn the program over to you.
Thank you, Linda. Hello, everyone. Today we're going to discuss hepatitis. The World Health Organization refers to hepatitis as one of the oldest diseases known to man. And scientists have discovered hepatitis viruses in the fossils of ancient birds and fish. But it wasn't until 1963 that we truly began to understand hepatitis. That was when a doctor discovered the antigen that detected the presence of hepatitis B in blood samples. Our objectives for this webinar are to discuss the different types of hepatitis, describe the risk factors for acquiring hepatitis, explore various ways to prevent hepatitis, discuss the rationale for standard precautions, and identify ways to minimize exposure to bloodborne pathogens. So what is hepatitis? Hepatitis is inflammation of the liver. The liver is a vital organ that processes nutrients, filters the blood, and fights infection. When the liver is inflamed or damaged, its function is affected. Inflammation of the liver causes walls of scar tissue to form, which then trap healthy liver cells and impair function. Heavy alcohol use, toxins, medications, and certain medical conditions can cause hepatitis. However, the most common cause of hepatitis is a virus. For this webinar, I'm going to focus on viral hepatitis. In the United States, the most common types of viral hepatitis are hepatitis A, hepatitis B, and hepatitis C. There are actually 7 types of viral hepatitis, but 5 common types that are caused by 5 distinct viruses. Hepatitis A, B, and C are the most common types and will be our focus. Hepatitis D can cause both acute and chronic disease, but the hepatitis D virus requires hepatitis B to replicate. So you cannot have a hepatitis D infection without hepatitis B. However, if you do get a co-infection or superinfection of hepatitis D with hepatitis B virus, it is a much more severe disease than a strictly hepatitis B virus. Hepatitis E virus is spread by the fecal-oral route and is usually found in contaminated drinking water in developing countries. The 2 additional viruses that have been identified are hepatitis F and hepatitis G. When there is acute hepatitis that is not attributed to hepatitis viruses A through E or to alcohol, drugs, or autoimmune disease, then they are most likely caused by hepatitis F or hepatitis G, but these are very rare. Hepatitis F virus has been found in patients who have had liver transplant for hepatic failure, and hepatitis G virus has been found in the blood and liver tissue of patients who had hepatic failure and liver disease of unknown causes. The 5 viruses that are most frequently seen have different modes of transmission, as you can see on the slide. Hepatitis A and E is fecal-oral transmission. Hepatitis B and C are transmitted by blood and body fluids. And like I said before, hepatitis D travels along with hepatitis B to cause infection. There are many risk factors for hepatitis, and they're listed on the screen that increase your risk of exposure: contaminated food, child care, close contact with an infected person, contaminated equipment, poor sanitation, poor hygiene, IV drug use, sexual contact with an infected person, incarceration, travel to areas where hepatitis is endemic, and being a healthcare worker. People that have underlying liver disease such as hemochromatosis or autoimmune hepatitis have an increased risk of developing symptomatic hepatitis, and alcohol use, smoking, HIV infection, and fatty liver also increase the risk for the progression of hepatitis. Signs and symptoms of hepatitis. Hepatitis infection affects each person differently. Many people with hepatitis do not know they do not have symptoms and are not aware that they are infected. If symptoms do occur with an acute infection, they appear anytime from 2 weeks to 6 months after exposure. With chronic viral hepatitis, symptoms can take decades to develop. If a person is symptomatic, the common symptoms include fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, gray-colored stools, joint pain, and jaundice. So let's talk about the 3 hepatitises we're focused on individually. Hepatitis A is spread when a person ingests fecal matter, even in microscopic amounts, from contact with objects, food, or drink that is contaminated by feces or stool from an infected person. For example, if an infected person uses the bathroom and doesn't wash their hands, they can then spread and contaminate the environment. They can touch door handles, or if you're in the mall, touch the ATM. Anything they touch can then be a reservoir for the virus. Someone else comes along, touches the same object, and fails to wash their hands before eating, drinking, or touching their face, can lead to transmission and infection. In this country, there's about 2,500 new infections of hepatitis A each year, but we do have a very effective vaccine available. So we can prevent hepatitis A through vaccination. However, outbreaks still do occur. There is a current outbreak continuing in California, and it is one of the most severe hepatitis A outbreaks that has been seen. So far in San Diego County, there have been over 400 people sickened with hepatitis A and 16 deaths from this outbreak. Most of these infections are occurring among the homeless population and IV drug users. So to combat this outbreak, public health officials are focusing on vaccination, sanitation, and education. They have currently vaccinated over 21,000 people, mainly homeless, and have also placed portable hand-washing stations on the street and instituted enhanced cleaning of public areas with bleach. When we talk the vaccination for hepatitis A, recommendations for vaccination are to vaccinate children at age 1. Travelers heading to regions or countries where hepatitis A is common are recommended to be vaccinated. Family and caregivers of recent adoptees from countries where hepatitis A is common are recommended to be vaccinated, and people with certain medical conditions, including chronic liver disease and clotting disorders. With hepatitis A, you can be sick for a few weeks to a few months, but most people recover with no lasting liver damage. And although very rare, death can occur from hepatitis A. If somebody is actively infected, then it is supportive treatment. They treat the symptoms. They keep the patient hydrated and treat their other symptoms such as the nausea and the vomiting. Hepatitis B can range from being a mild illness lasting a few weeks to a lifelong chronic condition. Hepatitis B is a leading cause of liver cancer. There are an estimated 850,000 to 2.2 million people who are living with chronic hepatitis B, and we see approximately 19,000 new infections each year. There is a very effective vaccine to prevent hepatitis infection, so prevention is done through vaccination. Vaccination for healthcare workers started back in the 80s, and I'm sure that most of you are vaccinated, but are you checking to make sure your employees are vaccinated? Hepatitis B is primarily spread when blood and body fluids from an infected person, even in microscopic amounts, enter the body of somebody who is not infected. It can be transmitted from an infected mother to her unborn child. It can be transmitted through shared equipment that has been contaminated with blood or body fluids, such as needles, syringes, or medical equipment like glucose monitors. And it has also been found to be transmitted from poor infection control in healthcare facilities. The risk for chronic hepatitis B infection depends on the age of the person when infected. Studies have shown that people that are infected have it as an infant have a 90% chance they will develop a chronic infection. And of those people with chronic hepatitis B infections, 15 to 25% of them develop liver disease, including cirrhosis, liver failure, or liver cancer. Who should be vaccinated? All infants are vaccinated at birth. Adults with diabetes should be vaccinated. Uninfected household members and sexual partners of people with hepatitis B should be vaccinated. People who are IV drug users, people with certain medical conditions such as HIV or chronic liver disease, and people who travel to areas where hepatitis B is common should be vaccinated. Hepatitis C can range from a mild illness lasting a few weeks to also a serious lifelong infection. With hepatitis C, some people who get infected are able to clear the virus, but most people who get infected develop chronic hepatitis C. However, many of these people do not know they're infected. Hepatitis C is the leading cause of liver transplants and liver cancer in this country. When it comes to prevention, we do not have a vaccine available to prevent hepatitis C. Hepatitis C is also spread by blood and body fluids. And 75 to 85% of the people who get infected with hepatitis C will develop a chronic infection. Of those people, 20% will develop cirrhosis, and 1 to 5% will die from that cirrhosis or from liver cancer. Treatment, if it is an acute infection, is antivirals and supportive care for symptoms. And if it is a chronic infection, then they are monitored for signs of disease progression. They are treated with antiviral drugs. But we now have some new antivirals that can cure hepatitis C. And I'm sure all of you have seen the commercials on TV for Harvoni. Harvoni is a combination drug. It is a combination of two drugs, sofosbuvir, which is an older drug, and a new drug called ladipicir. This combination is very effective and has a cure rate of 94 to 95% of those treated. If the infection is identified and the patients are treated, they can get rid of the virus before they suffer liver damage and liver failure. So who should be tested for hepatitis C? Well, they recommend testing people born between 1945 and 1965, people who received blood transfusions or donated organs before 1992, or clotting factors before 1987, people who have a history of IV drug use, long-term dialysis patients, and people with known exposures to hepatitis C. And they also recommend treatment of people with signs and symptoms of liver disease. So when we talk about those three hepatitises, your ABCs, how are they transmitted? Well, the common means of transmission in this country for hepatitis A would be ingestion of contaminated food or water, and for hepatitis B or C would be sharps injuries, such as needle sticks or scalpel cuts, splashes of blood or body fluids into your eyes, nose, or mouth, open skin contact with blood or body fluids, sexual contact with an infected person, an infected mother to her unborn child, sharing of needles and syringes, and blood transfusions. That happened in the past, but it is very rare now as we do a much better job of testing our blood supply. So when it comes to prevention of hepatitis, we do have vaccines available and vaccination for hepatitis A and B. And this is my plug for vaccination no matter what the disease is, but especially in the case of hepatitis. It is always easier to prevent a disease than to treat it. So vaccination is highly recommended. The other way to prevent, when you're talking hepatitis C that has no vaccine available, is mitigation of the risk factors. That is very important to prevent the spread of disease. Sanitation, proper food handling, decreasing or eliminating risky behaviors can all help decrease those risk factors and aid in prevention. For hepatitis B and C, common transmission occurs from exposure to bloodborne pathogens, which is very important to all of us in the medical field. So what are bloodborne pathogens and how do you prevent transmission? Well, a bloodborne pathogen is any disease-causing germ that is present in blood and body fluids. In 1991, OSHA released their bloodborne pathogen standard and then revised it in 2001. December 6th of 1991 is when the bloodborne pathogen standard was released, and it mandated universal precautions as a protective approach against occupational exposure of healthcare workers. That was then revised in 2001. This bloodborne pathogen standard covers all occupational exposure to blood and body fluids, and adherence to the standard is mandatory. All healthcare facilities must follow the bloodborne pathogen standard. So when we talk bloodborne pathogen standard, it's any disease-causing germ present in blood and body fluids. And examples would be HIV, hepatitis B, and hepatitis C. The blood and body fluids are the vehicle that the pathogen uses to transmit the infection and a communicable disease. So what are ways of being exposed to these bloodborne pathogens? Well, common ways of exposure for healthcare workers are when you're drawing or analyzing blood, if you're handling or removing contaminated waste, if you're handling contaminated equipment or laundry, cleaning up blood or body fluids, or rendering first aid. And when you think about any of the jobs that are performed within your facilities, they all put you at risk for exposure to bloodborne pathogens. So how do you minimize your exposure? Well, you minimize your exposure through following standard precautions. Standard precautions are what you do to reduce your chance of being exposed. Infection prevention is not a court of law. We consider all patients to be potentially infectious until proven otherwise. So you need to protect yourself. Consider all the patients infectious and use appropriate barriers at all times. I always say to think, contain, and confine. Think of what the job you're doing and the area that's contaminated. You want that area to be as small as possible. So keep all of your equipment and supplies that are contaminated as close to the patient as possible. Consider everything in that contaminated area and the patient to be considered a possible source of transmission. And the items that are contaminated must be contained until they are disinfected. The term standard precautions appeared in 1996 in the CDC's isolation revisions. They're a combination of universal precautions and bloodstream infection precautions were combined to form standard precautions. Standard precautions apply to all patients receiving health care, regardless of their diagnosis or their presumed infectious status. All patients are in standard precautions at all times, patients or residents. Standard precautions is the fundamental premise used by healthcare workers when they provide care to every patient or resident they come in contact with. The components of standard precautions are hand hygiene, the use of personal protective equipment, engineering controls, and sharp safety. The goal of any precaution, whether it's standard precautions or specialized precautions, is to prevent the spread of communicable disease and microorganisms among patients or residents, healthcare personnel, and visitors. So we're going to talk about hand hygiene. Hand hygiene is the most important measure you can use to prevent the spread of infection. When it comes to hand hygiene within your facility, it is imperative that everyone perform hand hygiene. Have you taught your workers the correct way to perform hand hygiene? And have you taught residents and family members how to perform hand hygiene correctly? The World Health Organization has 5 moments for hand hygiene, and these are those 5 moments. You should perform hand hygiene before you touch a patient or resident. You should perform it before doing a clean or aseptic procedure. You should perform it after a body fluid exposure risk. It should be performed after touching a resident or patient and after touching the patient or resident's surroundings. When it comes to hand hygiene, alcohol-based hand rubs kill more effectively and more quickly than washing with soap and water. They are also less damaging to the skin than soap and water and cause less irritation or dryness. So what is the correct way to use an alcohol-based hand rub? Well, you apply it to a palm of one hand and make sure you get enough rub so that it takes at least 15 seconds for it to dry on your hands. Apply it to the palm of your hands and then briskly rub your hands together, covering all surfaces, making sure to rub between your fingers, around your fingertips and your fingernails, and around your wrists, the same as you would when you do hand hygiene with soap and water. But you continue to rub until your hands are dry. You do not dry your hands with a paper towel. You continue to rub in the alcohol gel until it is dry. The alcohol itself will kill pathogens that are present on your skin. If you are washing with soap and water, then you need to wet your hands with warm water. And we tell people to use warm water for 2 reasons. Number 1, warm water is less drying. And number 2, people, if they use warm water and not hot, are more likely to perform a good hand wash and wash for at least the 20 seconds. But you wet your hands, apply the soap, and then briskly rub your hands together for 20 seconds, covering all surfaces, making sure you get between your fingers, on the back of your hands, around your wrist, and paying particular attention to your fingernails and your fingertips. Once you have scrubbed briskly for the 20 seconds, then you rinse the soap off under running water and dry your hands with a disposable towel. But do not throw the towel away immediately. You need to use the towel to turn off the faucets and then turn off the door handle. if you do not use the towel to turn off the faucets, you will pick up the germs that were not only on your hands, but on the hands of everyone who used that sink prior to you. When it comes to hand hygiene, you need to monitor compliance. In your facility, how do you know your staff is compliant with hand hygiene and performing it when it should be done? You should be monitoring compliance and providing feedback to staff. I put a link here to an advisory that was done by one of my coworkers, Sharon Bradley. It has some very valuable information to assist you in hand hygiene compliance at your facility. And I would recommend that you go to this advisory and see what's available. There are also some tools there to help you with your monitoring. Another part of standard precautions is personal protective equipment. And this is a very important part. Personal protective equipment are barriers that minimize the risk of body fluid exposure by protecting your skin and mucous membranes from potentially infectious materials. If you anticipate the chance of being splashed, splattered, or contaminated in any way by the job you're about to perform, then you need to wear personal protective equipment. Personal protective equipment can be gowns, gloves, masks, or protective eyewear, but you need to remember, even though you have worn personal protective equipment, you must thoroughly wash your hands after removing the equipment. I tell people to dress for the occasion. Think about the job or task or procedure you're going to perform and anticipate potential ways you could be exposed or have splashing of blood or body fluids. We've already discussed hand hygiene, but gloves are an important part of this, and we're going to discuss them in much more detail. But when it comes to gowns, if they are disposable, are worn only once and then disposed of. Some places I do know use aprons that are reusable, but if you have used that apron, it must be disinfected immediately after use for the next person. Masks, it is very important if you are wearing a mask, you must cover both your mouth and your nose to protect yourself. You have mucous membranes lining both your nose and your mouth. The mask must be fluid resistant because the protection is focused on unanticipated splashes. You need a new mask for each episode of patient care. You should not reuse the mask or use it from patient to patient. And if your mask should become moist, then it must be disposed of because it will not be effective. When we talk eye protection, many types of eye protection are reusable, so they must be cleaned immediately after use. But you can also get masks that have a built-in eye shield to protect your eyes. But one thing I'm going to say with eye protection is it only works if you put it on before the splash or splatter occurs. And eye protection is one part of personal protective equipment a lot of people forget about. So let's talk about gloves. You need to put on new gloves before contact with non-intact skin or mucous membranes. And you must wear gloves during contact with blood or body fluids or any contaminated items. You need to remove your gloves after caring for one patient. You never wear the same pair of gloves from patient to patient. But it's also extremely important to remember you need to change gloves when caring for one patient if you are moving from a dirty area to a clean area. For example, if you've just given Foley care, before you go to do other care, you need to change your gloves because you don't want to go from a very dirty area to a clean area. Gloves are not reused, and we do not wash them. They are disposable. But you must perform hand hygiene when you remove your gloves. Gloves are not a replacement for that. There have been some very good studies out there that were done that when gloves come off, you still find bacteria on people's skin. Now, whether they contaminated their hands removing their gloves, or maybe the gloves had tiny imperfections, we don't know. Another part of using gloves correctly is you need to do hand hygiene before you ever don the gloves. Think about it. Bacteria like warm, moist, dark environments. We all carry thousands and thousands of bacteria on our skin. If you don't do hand hygiene prior to putting your hands into a pair of gloves, you have now provided that bacteria with the perfect incubator because it is warm, it is dark, and it is moist. So you need to do hand hygiene before the gloves go on, and you absolutely must do hand hygiene when the gloves are removed. So when should you wear gloves? Well, like I said before with standard precautions, think about the job you're going to perform. If your hands are going to become contaminated with blood or body fluids, excretions or secretions, if you're going to be touching mucous membranes or non-intact skin, or if you're going to be touching contaminated surfaces or objects, then you must wear gloves. Along with putting the gloves on, I want to review how to put on your PPE because it should be put on in order. On the right-hand side of your screen, this is a poster that is available off the CDC website that you can print out for use within your facilities. When you go to put on your personal protective equipment, you need to do hand hygiene first. Just remember there are thousands and thousands of bacteria present on your hands, and you need to decrease that bioburden by performing hand hygiene before you touch the clean gown, the masks, the eye protection, or the gloves. But once you've done your hand hygiene, then your gown goes on first. And when you put the gown on, it needs to fully cover your torso from your neck to your knees. Your arms need to be covered to the wrists, and then the gown needs to be wrapped around your back because it is possible to contaminate your uniform if your gown is not tied correctly. It gets fastened at the back of the neck and around your waist. The next thing you put on is the mask or respirator if you're wearing one, depending on the job you're about to perform. The mask should be secured with either ties or elastic bands at the middle of the head and neck. And the mask would have a flexible band. You'll see like a metal strip or flexible band in it that goes over the bridge of your nose that needs to be snugged up and tightened around the bridge of your nose. And then you need to make sure that the mask goes underneath and below your chin. If you are wearing eye protection, they go on next, and that needs to be placed over your eyes and your face. Regular glasses do not provide adequate eye protection. You need to wear either a face shield or goggles to totally protect your eyes if needed. And then the last thing that goes on when you're putting on PPE is your gloves. And they go up to cover the risk of the isolation gown so that you have all areas of your skin covered. After performing your task, when you go to remove your PPE, or doffing as it's called, these are the Center for Disease Control's recommendations, and this is also posters you can print out off of their website on how to safely remove your personal protective equipment. When you go to remove your personal protective equipment, always think of the front of you as being most contaminated because that is the areas that were most likely in contact with the patient, resident, or the contaminated surfaces. So your gloves come off first. The outside of your gloves are obviously grossly contaminated, so when you take your gloves off, you fold them within themselves and then dispose of them. If you are wearing goggles or a face shield, that would come off next. And like I said, you consider the front of your body to be most contaminated. So if you are wearing goggles, lift them off by the arms and set them down. Or if it's a face shield, lift it off by the bands on the side and set it down to be cleaned later, if it is reusable. Gown comes off next. Consider the front of your gown and sleeves to be grossly contaminated. Use your hands to untie your gown at the neck and at the back, and then lift at the shoulders to pull your gown down away from your neck and shoulders, and roll it inside to contain as much of that contamination as possible and immediately dispose of it. If you are wearing a mask, do not touch the front of the mask. The mask is removed by the ties or the bands and disposed of. And why it's important not to touch the front came to light when the SARS outbreak happened, and we had healthcare workers in Canada who developed SARS even though they were wearing personal protective equipment. When investigation was done at that time, what they found out is healthcare workers were grabbing their masks by the front, which was then aerosolizing the bacteria, and they were removing their mask, which then had that bacteria right there to breathe in. So you want to manipulate any of this equipment as minimally as possible. So do not ever grab the front of a mask to pull it off. Take it by the ties or the bands that go around your ears to remove that mask. And then most importantly, when you have removed this equipment, you must perform hand hygiene because you will have picked up some pathogens again onto your hands. This is another way that PPE can also be doffed or removed, and I provided both of these because some people like one way more than the other. I will be honest with you, I am not very good at removing my equipment this way. The way you remove this equipment is your gown and your gloves are removed at the same time. You break or untie the ties of your gown and gloves, and then when you remove it, you're pulling it off, and it is pulling those gloves off with it. After gown and gloves are removed, goggles come off, and then your mask or respirator, same as I told you before. Do not touch the front of the mask. Do not touch the front of your goggles or face shields. Consider that most contaminated. You try to touch the areas of least contamination, which would be the arms of the goggles or the ties on the mask, and then again, you must perform hand hygiene. Another part of standard precaution is engineering controls. And your engineering controls are any items or things you do which isolate or remove the hazard from your workplace. Think your sharps containers, your red bags, your biohazard bags, safety needles, and needle devices. Another part of engineering of standard precautions is safe work practices. You do not want to eat or drink in work areas where blood or body fluids may be present because there could be pathogen there that you could then ingest. Another safe work practice is hand hygiene. Another safe work practice is to clean and disinfect contaminated areas. And think of your stations on your resident areas or your nursing units. Multiple people come through there every day. Multiple people use the shared equipment such as keyboards, telephones, that sort of thing. We would like to think everybody does hand hygiene when they should and that those areas would not be grossly contaminated, but we all know better than that. So when it comes to sharp safety, always use the appropriate container. If you're using safety devices, if it's a needle safety device or a sharp safety device, make sure the device is activated. Those products can only protect you if you activate the safety devices. And make sure your staff know how to activate those devices correctly. Any used sharps should be discarded immediately. If they are set down to be discarded later, there is chance of somebody else injuring themselves, and we do not recap needles. Another part of this is the one needle, one syringe, one time practice, and that's part of the CDC's One and Only campaign. There have been some outbreaks associated with people reusing syringes and needles, so it is one new needle each time for each patient. Unsafe injection practices can lead to the transmission of life-threatening infections. You can have an infected person, whether it's a chronic infection like hepatitis or an acute hepatitis. We give them some type of injection, and then take that syringe, and instead of disposing of it immediately, it may be used to draw more solution out of a vial, which then contaminates that entire vial or equipment, which then can be used for somebody else. So it is important to remember it is a new sterile syringe and needle each time. This is the link to the authority's website. There is education available on our website for sharp safety, hand hygiene, and other infection prevention topics. I strongly encourage you to take the time to go to the website and review what education or tools are available there for your use. So how do we integrate standard precautions into your everyday practice? Well, you need to increase the awareness of its standard precautions with all the workers within your facility. Engage them in discussions on standard precautions. Engage them in the policy development, and provide education to them on standard precautions and on bloodborne pathogens. That's also part of OSHA's bloodborne pathogen standard. You must provide yearly or annual education, and you also need to engage your workers in the selection of safety devices and also in bloodborne pathogen standard development. And then you need to monitor compliance. Evaluate, are people following the precautions? Are they wearing PPE when it's necessary? Do they know how to wear PPE correctly? And is education being provided? So some takeaways from this talk. You need to always protect staff, your residents or patients, from infection and from harm. And that is a basic standard of care. That should be done at all times. Standard precautions and hand hygiene should be understood and followed by all members of your care team, including managers, owners of facilities, contracted staff, and volunteers. Because at the end of the day, all of us are patients. I'm going to turn this back over to you, Linda, for any questions.
Okay, thanks, JoAnn. That was really informative. It contained a lot of valuable information that everybody can use in their organization. So that concludes our slide presentation portion, and like JoAnn said, we're going to begin the question and answer period. So there were a couple questions. The first one was, one person said, we require that staff use a dry paper towel to turn off the faucet during hand hygiene and open the door, as a wet or damp towel is no longer a barrier and it undoes all the good hand hygiene you just performed. Is this incorrect?
If that is your policy, that is fine. When you look at the guidelines put out there by FAPIC, they don't specify it must be a new paper towel. They say that when you have dried your hands, since that paper towel is readily available, to use that one to turn off the faucets.
Okay, great, thanks. Another question, how long can the hepatitis virus live on surfaces?
The viruses will live for hours on surfaces. There are some studies out there that have found the hepatitis virus to live for 12 to 16 hours. There may be other studies that show a longer time frame, but those I would have to look into. But I know that they will live for hours on surfaces, whereas bacteria can live for weeks on surfaces.
Okay, great. Thank you. What is the preferred test to perform to confirm a healthcare employee is vaccinated against Hep B?
You would perform a titer to see if they have antibodies against hepatitis B.
Okay, great. So another question is, can someone be diagnosed with hepatitis and not have A, B, C, or D?
Like I said, hepatitis is inflammation of your liver. You can have hepatitis that is caused by alcohol abuse, that is caused by some medications. Certain autoimmune diseases can cause that liver inflammation. Viral hepatitis is what we refer to when we talk about hepatitis A, B, C, D, or E. They are the actual distinct viruses that cause viral hepatitis.
Okay, yes, great. I just want to, there's a follow-up. The question you just answered about how you can tell if an employee is vaccinated against Hep B, she had a follow-up question. Is the Hep B surface antibodies or antigen? I'm guessing that means, is that what they're testing for?
I have to look that one up, Linda, and get back to that person because I just drew a blank in my brain. So I'll have to look that one up and get back to her because I just drew a blank.
Okay. And then the question is, are the alcohol sanitizers effective for norovirus and C. diff, or do you have to use soap and water for both of those?
Soap and water for norovirus and C. diff, especially for C. diff as it is a spore former, but we recommend soap and water hand wash for norovirus and C. diff, and it is important to make sure that your employees are washing correctly. Are they scrubbing for the 20 seconds? Are they rinsing? And are they turning off the faucets with the paper towel?
Okay. Are there any other pathogens that you can think of that you need soap and water rather than the alcohol wipes?
You mean the alcohol gel?
Yeah, the alcohol gel.
We, in infection prevention, prefer alcohol gel because the alcohol actually kills the pathogens on your hands as opposed to soap and water where the friction removes them off. But when you have a spore former, such as C. diff, you must use soap and water, and the friction then removes those spores off of your hands because the alcohol gel will not be effective in killing those spores.
Okay, great. Can you use cloth gowns for PPE, or should disposable ones always be used?
You can use cloth gowns. Disposables, most places have gone to because they don't have to worry about laundering them or transporting them to be laundered. But when you look at the standards, they recommend disposables, but cloth gowns are still available as are aprons. But if you're wearing a cloth gown, you have to remember to protect your arms down to your wrists. Okay.
And before what year is it that a person should be tested if they had a blood transfusion?
Okay, that's going to get into the hepatitis C and the baby boomers. I know you've all seen the billboards, heard the TV ads that baby boomers must be tested for hepatitis C. And the reason for that is most of them are unaware they even have a hepatitis C infection because Hep C can take up to 5 decades to evolve into a symptomatic disease. They initially thought the baby boomer population was at a higher risk because we were the quote-unquote drug, sex, and rock and roll gang. But they've done much further research, and they're now attributing it to the medical practices of the 50s and 60s, and found that most of the baby boomers were infected around age 5 to 8. And what they're finding is when they look back to the standard of care post-World War II, and I can remember this because I'm of that age, it was reusable glass tube syringes and metal needles for injections and blood transfusions. And the usual practice back then was to sterilize these syringes, needles with boiling them. And they're now thinking that is attributing to the very high incidence of hepatitis C among the baby boomers. But when it comes to blood transfusions, anybody who received blood transfusions prior to 1992 should be tested for hepatitis B and C. And anybody who is of the baby boomer generation, such as me, needs to be tested for hepatitis C because 3 out of 4 cases of hepatitis C are among the baby boomers. They have the very, very high incidence of it. So they need to be tested.
Wow, that's really interesting. Thanks. That's very good. Here's another question. How many patients can you use gel for before using soap and water?
There is no magic number out there. They do tell you to use soap and water before you eat. And after you use the restroom. And I also would tell my staff in a previous life to use soap and water because, you know, sometimes with the alcohol gel, you will notice your hands feel tacky after multiple uses, to use the soap and water then. But there is no magic number for that.
Sounds good. Sounds like common sense. Another question. There's been a recent hepatitis C outbreak in a long-term care facility. What can we all do to prevent this from occurring?
There was a hepatitis C outbreak in a long-term care facility in North Dakota, and that was a lot of articles that were published earlier this year. They had 54 infections out of a 114-bed facility. And when the North Dakota Department of Health went in there and investigated, they also brought in professionals from FAPIC to observe practices. They did not find the red flag that they could attribute to all of the infections, but what they did identify is poor infection prevention practices. And I'm going to tell you some of the things they observed. They observed that nail care was being done where one set of clippers was being used for multiple patients, and they did not observe cleaning between those clippers. They also observed some needle and sharps practices that were not following the guidelines or standard of care, and that these patients had podiatry procedures done. Not all the time was there bleeding, but many times it was the same instruments being used, and they did see the instruments being disinfected at times, but they could not verify that was done every time. So my takeaway from all this is when you're in your facilities, is there a dedicated pair of nail clippers for each resident or patient? You should not be sharing them. And even if they are dedicated to that person, are they being disinfected after each use and stored appropriately? During any type of phlebotomy practices, are the evidence-based guidelines being followed? Is it one needle each time, a new needle and syringe for each patient? Are the sharps being disposed of properly? And one of the things they identified was very questionable cleaning practices in this facility of the glucose monitor. If your glucose monitor is shared, it must be disinfected after each use and between each resident. And it is recommended that they not be shared, that each person should have their own glucose monitor. So you need to take a look at your practices and make sure that you are cleaning and disinfecting equipment appropriately, that you are not sharing equipment, and that you are following the appropriate evidence-based guidelines for the use of sharps.
Okay, great. Yeah. So one more question that I see, should the infectious laundry be washed separately, or can it go in with all the other laundry?
Laundry, all laundry is considered contaminated. We all carry millions of germs on our skin, so we consider all laundry to be grossly contaminated, and it needs to be laundered according to guidelines. Your water temperature has to be at a certain level, using the right products and for the right amount of time, but all linen is considered contaminated, so it can all be laundered at the same time.
Okay, great.
I do see one more question here. It says, do you recommend hepatitis B boosters to be given? You need to look at the titers on the patients and make sure they have active protection and appropriate protection. If their titers are low or they do not have titers, then they would need to be revaccinated. But that's something that your employee health person needs to look at. They do think that the vaccination for hepatitis B will be a lifetime, but because we just started vaccinating in the late 1980s, we can't make that statement yet because we've only been 35 years out. But you go by the titers for any vaccine to see if they have effective protection.
Yeah. Yeah, and we can't assume because, different people's immune systems react differently also. So, correct. Good point. So this concludes our webinar. Thank you, everybody.